of the most frustrating things to deal with as a cat owner is urinary issues. No one wants to come home and have their house smelling like cat pee. But don't worry, there's a lot of things that we can do to kind of troubleshoot and help. I'm Dr. Meggs, and this is Everyday Vet. There are several different urinary issues that you might be seeing in your household, so I'm going to try to cover some of the more common ones. First, let's start out with the true emergency. So if you have a cat that's trying to urinate, visibly straining, crying, and really not producing any urine, make sure you bring it into the veterinary clinic immediately. That can be a sign of a urinary blockage. So that might be like a little bladder stone or even like a blood clot. Basically anything lodged in the pathway from the bladder out of the body can prevent that urine from flowing through. So that's definitely an emergency and really painful for your pet. So make sure you get that seen immediately. Now, there are, of course, some other things, too, that can happen that aren't necessarily emergencies, but should still be seen when able. Anything ranging from, like, where your cat is urinating to color, frequency, volume of urination. All of those things mean something. So first, let's start with the most common one I see. Cats that are urinating outside of the litter box in small, frequent volumes. They can get what's called feline idiopathic cystitis. This is basically an inflammatory response inside the bladder that doesn't actually have any infectious causes. So it's not a bacterial infection, it's truly just the inflammation. A lot of times this can actually be due to stress. But unfortunately, the only way to really know is to check the urine for bacteria. So even if you have a suspicion that this might be what's going on, you'll want to bring your cat to the vet and have it checked out. So basically, urinary tract infections and non-infection cystitis, so inflammation, look very similar, and you're going to be seeing these small volume frequent urinations. So let's move on from there then to what happens if we see like large volume urinations. So basically, these are going to be the cats that are maybe drinking a lot and urinating a lot, but by a lot, I mean volume this time as opposed to frequency. So you're going to see big amounts of urine in the actual litter box. These don't tend to be painful, so you usually still see your cat using the box. That being said, sometimes we do see them going out, but typically it's going to just be an overall increase in urine production. That typically indicates something a little bit more serious than our small volume frequent urinations, and it depends a little bit on the cat. So whenever I hear this happening in cats, my top two things that I'm concerned about are going to be kidney disease or diabetes. Now, looking at your cat, you can kind of tell which one they're more likely to have, but you never know for sure what's going on with your cat until you do the lab work. So please don't take this as like a diagnosis of your cat. We don't know what's going on until we get the blood work values or the urine information. But just kind of as a general guideline and tendency, cats that are overweight and obese are more prone to developing diabetes. So more often than not, if I see an overweight cat that's urinating really like large volumes, it's usually going to be more likely to be diabetes. But again, we don't know that for sure until we've done the blood work. Now, on the opposite side of that, cats that maybe are a little bit older or have some muscle loss are on the thinner side, and having these large volumes of urination, that's going to have a higher likelihood of being kidney disease. Now, again, I don't know that until we get the values, but that's what my suspicion would be. So anytime we see any kind of changes in urination in your pet, we definitely want to consider going to the veterinarian and getting that looked at, seeing what the underlying cause is. Your veterinarian will probably want to do a blood work panel that's going to look at just overall evidence of inflammation in the system, as well as check those kidney values and sugar level and make sure we're not dealing with something like that. Other things that they might want to check is a urine sample. Make sure that we're not dealing with urinary tract infection versus non-infectious inflammation. But keep in mind, if once we rule all of those other things out, we also have to consider the role that stress can play in your cat's life and overall behavioral changes. So if everything looks normal on the lab work, we're often left with this idea that maybe it's a behavioral problem. So maybe your cat has a preference for different materials in the house, or maybe it's just stressed out in general, especially if there's outdoor cats in the environment. If your cat is feeling protective of its environment, it might spray on the walls to kind of mark it as its territory. Or if you have a male cat in the household that's not neutered, he might be spraying as well as a marking type behavior. So at least good news there is, if you have a male cat that's not neutered, I'd recommend getting him neutered, and that might help you out a lot. Otherwise, we're probably dealing with reducing stress. Now, there's a lot of ways to do that, and I do plan to make a video on ways to reduce stress in cats, so keep an eye out for that. But things that you can try in the meantime include Feel Away products. That's a pheromone that's geared toward helping reduce stress in cats. Your veterinarian will likely have this product, so you can definitely touch base with them. Otherwise, there's also a really great website that The Ohio State University has about indoor cats in particular. So I'm going to make sure to put a link to that so you can check out that website as well. But keep an eye out for that other video that I plan to make. Other things to consider too is overall litter box. So I did do an episode on cats that have problems with pooping outside of the box. A lot of the things that I talked about in that episode actually hold true too for urination. So make sure that you're setting up the litter box environment such that your cat actually likes it. And once we rule that out, then we can, start considering some of the other issues that might be going on with stress. But that's an easy fix that you can try to do in your home. And then, of course, we have to consider what medical treatments we might be doing. So, again, it's going to depend on what the underlying cause is, but we may need to do antibiotics if it's a urinary tract infection, maybe some pain medications too, just to keep your pet overall more comfortable. And I've also found that diet can often be really useful in a lot of these things. So if we're dealing with a stress type inflammation in the bladder, there's actually a prescription diet geared towards treating that. Or if we're dealing with kidney disease, there's a lot of diets that are, again, prescription to kind of help your pet with progression of kidney disease and keep them healthy longer. And then even if we're talking about diabetes, so we'll likely need to start your cat on an insulin treatment, but there's also diets that can be used too for cats. And once in a while, cats actually do go into diabetic remission. So if you do think that your cat has diabetes, don't panic. There's definitely a lot of things that we can do to treat it. So overall, we do have a lot of options and things that we can do to kind of keep your pet healthy and address these urinary problems. And I really think that this is a very important topic for our cats because it's one of the most common complaints I get. And it's really one of the top things that impacts the overall relationship that you might have with your cat. So, it's one thing to walk in the house and say, okay, you had a urinary accident. I know you didn't mean it, but to still, see that cat the same way and have that good relationship with them without holding a grudge can be really challenging. It's hard to look at them the same when they've just ruined your favorite rug or your couch and you're spending lots of money to repair your house. So it definitely has a tremendous impact outside of the overall health of the cat too. So really one of those conversations that you want to be having with your vets, that way you can fix this sooner rather than later. Even if it's been going on for a long time, there are always options and things that we can try to at least improve the situation. So please don't ever hesitate to have that conversation with your veterinarian because there's a lot of different things that could be going on. I know that was a lot of information, and I hope you found that useful. So if you'd like to leave me a comment below, I'd love to hear about what problems you might be having with your cat and what you found to be particularly useful. And of course, if you have any questions, make sure to let me know, and I'll do my absolute best to address them. But always make sure that you're talking to your veterinarian too. That way they can, provide targeted information specific to your cat. And then, as always, don't forget to hit like below and please subscribe to my channel. It really does make a difference for me, and I do appreciate that extra step if you do it. That way you can also stay up to date with my latest videos as well. But that about covers it for today. I'm Dr. Megs, and this is Everyday Vet.